Good evening, everyone. You are joining us again. This is our monthly telephone town hall and Facebook live town hall. So, of course, those of you watching on Facebook can see us. I'm sorry for that, but nevertheless can see us. And you are joined by thousands of our neighbors on the telephone. If you're on the telephone this evening, you are joined, as we all are, by Dr. Neil Wythian. Dr. Wythian is our Commissioner of Health, the Department of Behavioral and Community Health. If you have a question and you're on the phone tonight, dial 0, and we'll try to get to your question this evening. If you have a question on Facebook, please write it in the comment section below the live feed. We're going to try to get to as many as we've been trying to do. We'll try to get the sense of a series of questions and get to them. We certainly have some updated information to get through. If you're on the phone tonight with us, again, this is County Executive Mark Molinaro. You're joined by Dr. Neil Wythian. If you get disconnected and you'd like to be on the phone, back on the phone line, dial 845-765-7121, 845-765-7121. We want to go directly to dashboard and our data, just as an update. I can say this to you quite confidently. All of the data points in the right direction. We had a horrific month in January with the most deaths of any month these last 12, and we are just approaching a year since our very first identified positive case of COVID-19 here in Dutchess County. In January 2021, still the deadliest. That said, we have seen a slowing in the number of cases, a dropping of our positivity rate, and we have seen basically a leveling off of some of that severity, and we're confident that we're headed in the right direction. We just need folks to continue to be safe, to be aware of your own health and the health of your neighbors. Having completed over 520,000 tests these last 12 months, we have identified 21,769 positive cases since March of last year. Currently, a little bit higher than last week, but still in the neighborhood of relatively flat. We are at 1,177 active cases. As a additional bit of information, we're tracking the number of new cases per 100,000, and so for Dutchess County, that is 36.17 new cases. So this is a new data point we're including on the dashboard. It is one of the data points that the CDC points to for monitoring in-school or in-person school activity. And Dr. Wythian will talk a little bit about that in just a moment. But we're at 36.1 new cases per 100,000, 46 individuals hospitalized. That is relatively low these last couple of months. I think last week we were in the neighborhood of 55 or 60. We'll get to those numbers in a moment. 46 current hospitalizations. As I said, 404 individuals succumbed to the virus, and our positivity rate, 7-day rolling average, is 4.35%. Now, that positivity rate has been at about 4. It's been down to 3.8 over the last several weeks, a little bit over 4, and into about 4.5 the last week or two. But we've been hovering at about 4% positivity. For those of you who are paying attention to issues related to in-person education, we support kids going back to school. We have consistently said that young people in a structured environment have a less likelihood of contracting or transmitting the virus in a school setting. The CDC has updated its guidance as it relates to in-person education, and so we are including the data points on our dashboard, and we've advised school districts of what that is. So if a district, and all of our districts fall within what we would call a low transmission rate, in this case 4.35%, with a low to moderate rate of positive cases, we are at about moderate positive cases. The requirement to hold firm on the social and physical distancing is relaxed a bit. Dr. Wythian, do you feel comfortable talking a little bit about that while I have you? So I'll frame the question. We obviously get a lot of questions about kids going back to school. Our health department doesn't decide that, right? We're in a position of advising school districts. I don't want to put words in your mouth, but would you suggest to listeners that students are safer in a structured environment with mitigation than perhaps not? Is that your view?
Thank you for that question, Mark. I think, you hit on one key fact that needs to be stressed, is that we have been monitoring disease activity in the community and looking at where people are getting COVID and what are the points of transmission. And we do not find that the school setting, especially K through 8, is a high risk of acquiring COVID or transmission events within that setting. So with that, we think and we support, school districts and parents and educators' desire to bring students back into the classroom. Obviously, some of the things that we always monitor is ongoing incidence rates, the number of cases that are circulating in the schools, as well as, the circulation of variant strains within the community. And so with those two metrics, especially the incidence being low to moderate and the rolling average being low, I think it's reasonable for the school district to entertain or decide to bring more students back into the classroom setting.
So I appreciate that you were much more detailed than I was. So that's good to know, right? The department doesn't decide for the school districts. They get to decide. We've advised them. We've provided them, Dr. Wythe, in a memo that I believe is now available that talks to the social distancing requirements. Do you want to talk a little bit about that? The CDC suggests that if you're within those low rates of transmission and new positive cases, right? The CDC suggests that the social distancing requirement is not as important a mitigation step, so long as you are taking mitigation steps. Did I say that correctly?
Sure. So people have to understand there are multiple steps that are involved in reducing likelihood or opportunities for disease transmission, and in this case, a virus. And so we've known for the past year that social distancing, the amount of space separating individuals, wearing a face covering, a good form-fitting mask, respiratory hygiene, and avoiding crowded areas that may present an opportunity to be, a focus of transmission are beneficial in terms of lowering or preventing, disease transmission. In the school setting, if we know that the setting is, a low risk, then, easing some of these mitigation steps, such as social distancing, may be reasonable if all the other steps are being taken in terms of monitoring students when they come in the morning to make sure that individuals who are symptomatic or who may be sick do not come in, making sure that all students are wearing form-fitting masks consistently. Those are some of the steps that, in addition to all the other environmental administrative steps the schools have taken, have protected students to date. And so if we find that the cases are low and the metrics point to the fact that, it's low to moderate risk, then easing some of the mitigation steps, such as social distancing, may be reasonable if all the other steps are adhered to.
So for those watching and listening, if you're a parent in a school district, we've advised school districts that is the CDC expectation, that if that's the CDC guidance, if you're in basically a low to moderate range of new cases and positivity rates, which Dutchess County currently falls within, that adherence to the strict 6-foot social distancing is not absolute, so long as there's a commitment to those other mitigation steps, minimizing the potential for transmission. Now, if I'm a parent, and I am in my own school district, that want my children to go back to school, which I personally do, I would want to make a real commitment on behalf of my own children, and my neighbors ought to be making that same commitment that we have to be cognizant of our own health, right? We don't want to send kids in with symptoms, or if there's a potential that they've transmitted or contracted the virus, we want to make sure we're wearing our masks and really taking those steps to slow any transmission. Because, again, reducing the social distancing does open up the potential for transmission, but if you're following those other steps with some degree of diligence, well, then that's within the CDC guidance and certainly a safer environment. Did I describe that okay, Dr. V?
That sounds good, Mark.
I'm trying. I try not to put words in your mouth. So let's talk a little bit about vaccines. We're going to get to a couple questions. We're probably just going to start with Irene in Dover. Irene in Dover, we're going to pull you up in just a second. Irene, are you there?
Yes, I'm here. Thank you.
I think I know your question, and I'm going to let you go first so I can get to the others.
Yes, we are seniors that don't have access to internet. Our phone, I'm going to laugh with you, is a dumb phone. It's we can't do any of those things with it, you know.
Yep.
So I'm having difficulty trying to get to the paperwork that so we can get the shot.
So you're over 65?
Yes, I'll be 72 next month, and my husband will be 84 in April.
Nice. Well, okay, so that's a good point. What Dutchess County has done, and we are advertising this throughout our Office for the Aging, if you cannot get online to do the scheduling, and that is the New York State system, right? You've got to go through this online form with a pharmacy or even with us. You can dial 845-486-3555. I don't know if
Wait a minute, you said it too fast.
I will say it nice and slow for you. Don't you worry.
Okay.
It is 845
Mm-hmm.
486
486, okay.
3555.
3555.
And when you dial that number, you're going to press 1. Okay?
Okay.
When you press 1, it'll give you a very long update about what's going on with vaccines. You can listen to that if you'd like, and then press 2. And I'm sorry you got to press any of these buttons, but that's the way it works.
That's okay.
And once you press 2,
Uh-huh.
You're going to go to an Office for the Aging representative. If it's after hours, you might get the voicemail, but you'll get a representative. That person is instructed to input your information in the system. So we'll actually fill out the form for you and get you on the waiting list, or identify if there's an available appointment that you might be able to get to at a local pharmacy or some other clinic. So that's what you want to do, and I envy you. I wish that I was. My kids call it old school. Have an old phone.
Yeah, well, that's it. Yes, old school.
Well, my 4-year-old thinks old school is actually a school. So Irene, I hope that's helpful, and that's the number you would call.
Yes, it is.
Okay, and we'll be happy to help you.
Okay.
Thank you. Stay on the line with us.
Thank you very much.
You're welcome. Don't go
Okay.
anywhere. We have lots of other questions regarding making an appointment, and again, New York State is in charge of this system. This is not the way Dutchess County would do this. There is no central point to schedule an appointment anywhere. And the state has created these silos, right? Everybody who's giving a vaccine is sort of scheduling independent of everyone else because the state didn't give us the ability to centralize that. That said, if you are interested in making an appointment or getting one, if you want to do that with Dutchess County government, now you should know that Dutchess County government has some restrictions that the state places on us for vaccine distribution. We can't give them to everybody, and I'll get to that in a moment. But if you're interested in signing up to be considered for a Dutchess County appointment, you will visit Dutchess.gov/VaccineinfoForm, or just visit Dutchess.gov. Go to COVID information or COVID update, and then the vaccine update, and you'll fill out this form. We're going to ask you for some basic information. Remember, you're filling it out. You can fill it out for your parent, your child, your cousin, your aunt. You can fill it out for the grocery store clerk. But the information you put into that form must be the information of the patient, the individual wanting to get the vaccine. Now, we can use your email or your contact number, but the information included in that form must be for the person who wants the vaccine. Every week, when we get new appointment availability, we will randomly select the names from that list. We don't have some better way to do this. The system is it's sort of a computer-based, like just very basic spreadsheet randomizer. We just simply set the system. The IT department hits a button. We tell them how many appointments we need, and they randomly select those names. In fact, this evening, I believe we were awarded today. We were told today that we would receive an additional 700 doses this week. And in fact, this evening we'll be alerting 700 individuals from that form that there's an appointment available, and when you get that, you should sign up. The system is not exclusive, meaning New York doesn't allow me to send, for whatever reason, the database isn't protected. I send it to somebody. You need to fill it out and get your appointment information inputted into the system. So let's talk a little bit about total vaccines this week, where we are with some of the data points. I know there are a number of questions. We're going to get to a few of them. We did have a question, though, when can adults under 65 living in a private home with developmental disabilities be vaccinated? The answer is you can now. You qualify now. Anyone with a comorbidity, so developmental disabilities, qualify as a underlying vulnerability. Dutchess County is doing two things. You can fill out this form, as I described, the vaccine information form. Again, you can call 845-486-3555, 845-486-3555. If you want to get that information, you don't have internet access, or you have some difficulty filling the form out, go to this phone number and press 1, listen to at least a little bit of the message, and then press 2, and you'll get to an OFA, an Office for the Aging volunteer or staff person who will help get your information in. Otherwise, fill it out on that website that I mentioned, Dutchess.gov/VaccineinfoForm. We then, as appointments become available, as they are this week, we will randomly, again, this is an IT application. This is not me picking names out of a hat, but rather a spreadsheet that simply pushes out randomly the names of individuals. We'll then send you an email scheduling your appointment. So you can do that. The other is we have been hosting some pop-up clinics for those with developmental disabilities. There, we try to connect with people who receive OPWDD services. I have to make sure I say that right, and try to connect. So we are making that available to you. Now, if you're a homebound senior, there are not currently doses given to home health aides or enough physicians to go to your home. But we are working with the state. We are pushing on the state to make vaccines available to physicians so that we can get home health care aides, home health care nurses, your physician, in the position of coming to you to be able to do that. That is not happening yet. We believe that those who are homebound certainly have a significant vulnerability and that we need to be giving you access, but the state has not yet made that readily available. As soon as it does, we'll move on that. Now, the other thing I will tell you is just as we're doing these pop-up clinics for those with developmental disabilities, as we get more doses, our expectation is to have pop-up clinics nearer you. We might have a clinic in your neighborhood, which would allow those who at least have limited mobility get to you to get there to get to you to get a vaccine. Sorry about that. Here we are with vaccines. This is, let's give you an update. This is for this week, right? So Dutchess County represents 1.5% of the state's population. Currently, we have received 1.3% of the state's total doses. Now, what I will tell you is the state recognizes that Dutchess, Orange, Sullivan, and Ulster are below the state average. In fact, noticeably below the state average, or the state percentage. So, for instance, in our case, we represent 1.5% of the population. We've only gotten 1.3% of the doses. Now, for those of you thinking that Dutchess County isn't getting its fair share, that's true. But Orange County represents 1.95% of the state's population and has only gotten 1.2%. Putnam County represents 0.5, has gotten 0.5. And so you can see that Dutchess and Orange in particular are a little bit behind in the total percentages, but we're going to catch up this week. So I'm very happy to tell you that the state of New York has made available to us an additional 700 doses this week, which will help us move the needle a little bit more. Now, 10.9%, almost 11% of Dutchess County's population has gotten their first dose. That's 1 in 9 Dutchess County residents have received their first dose. The statewide average is 12.3%, so a little bit below the state average. But again, the state acknowledges that, and through our advocacy, we're very grateful to the state of New York for providing those additional doses. We will have access to more doses this week. This week, Dutchess County will administer more doses. Our health department, and by the way, countywide, will administer more doses this week than any other week prior. That includes approximately 1,200 doses that were postponed from last week because of the storms and weather conditions in Texas and across the country, a delay in distribution. So last week's 1,200 going to be administered this week. This week, we have 1,200. Doses, so 2,400 doses. And now we're adding to that this week an additional 700 for us to administer. So that is just over 3,000 doses the health department will be administering this week. Now we are required to focus on 1A, 1B populations. That includes a lot of essential workers, but also those with comorbidities. And again, in order to get a vaccine at a Dutchess County facility, if you have a comorbidity, you simply need a note, in essence, a confirmation letter from your physician. We have a healthcare conditions form, right? If you wanted to, you can print that out online. You visit Dutchess.gov, it's there, get it printed out. We don't ask you what condition you have. It's none of our business. It's just a physician that acknowledges you fall within the category of having one of those identified comorbidities. There are over 100,000 individuals in Dutchess County that now qualify. Again, that is how you would access and get an appointment. Barbara online asks if we can push the state to make the JCPenney's a state regional vaccine site. The answer is yes. Last week, I sent a letter to the governor. That letter comes after a conversation that we had in a public, not public, but a meeting between county executives and the governor, wherein the governor offered that if counties wanted to step forward and partner with him and the federal government to expand vaccine capability, that we could do that. So we made our offer. The JCPenney's facility is entirely appropriate. It's got great transit access, the first and second floor. So we have 185,000, nearly 200,000 square feet accessible. We've made that offer, and the governor's office in the state of New York is considering that. So we are happy that is being considered. We hope that we will be able to get the JCPenney's facility as a state-designated regional site. Now, the regional location the state of New York has established for the Mid-Hudson Valley is in Westchester County, the county center in Westchester. So you should be aware of that. Let's try to, why don't we go to Erin. Erin is from Pauling. Erin, we're going to open up and let you ask your, whoa, there you are. Okay, Erin, go right ahead.
Hi. I was wondering if I had filled out the vaccine information request form, but my date of birth changes in 2 weeks. Will that form update itself so that I would now then be 65?
Good question. Yeah. Well, first of all, your date of birth, I hope, doesn't change. Otherwise, I want to meet you because I would like to change my date of birth to, a couple of years ago. But yes, you know what I mean. I know what you're saying. But you're correct. So the form itself doesn't need to be updated for that purpose. We know based on your date of birth, the spreadsheet can identify your age, so that won't affect you in any way. But if you're listening and you feel like you must update your form, you have new information, we take the newest version of that form. So whatever you do to the vaccine information form once it's updated, we use the most updated form. But it does not, for the purposes of your age, you don't have to change. You don't have to update the form because, again, as long as your date of birth is in there, we get that included in the spreadsheet, and the magic behind spreadsheets does the math for us. But thank you for that question. We're going to go to Charles. Charles is in Hopewell. Charles, in 1 second, we'll get you going. Charles, are you there?
Yes, I am here. Thank you very much for taking my call. I appreciate it.
You're very welcome. Thank you.
Can you hear me?
I can. Go right ahead.
Yes. Okay, good. So I have been trying through the New York State website to get an appointment. I heard your previous information about the Dutchess.gov, and that will be my next internet search, and I really appreciate that information. As I said in my message, it's terribly frustrating on the New York State website to have, there might be 18 or 20 locations, and to have them all say no appointments available has been very frustrating for the last at least month for me. I'm 66. I have no comorbidities. My wife is immunocompromised, which is why it's important for me to get a vaccine. But I will look into Dutchess.gov, and hopefully I'll have, even though it's random, as you say, hopefully I'll have better success there.
Right, and I would thank you for that. And when you do go to Dutchess.gov, sign up for ours, as you mentioned. And also, though, visit, when you go on the page, if you scroll further down that page, you'll see that there are links to area pharmacies that have potentially have appointments, federal health clinics in the region. I think there are about 4 or 5 of them that may have appointments. So while I can't have, the county isn't able to consolidate all of that into a single point for appointments, you can look at those other links and also see if any of those have availability, and sometimes they do. Just as we did today, randomly get an additional batch, and we're grateful for that. There are others that are getting the same. So thank you for asking that question. We appreciate and hope that I hope that I was able to give you a reasonably good answer. I appreciate that. Thank you very much. We're going to go to Ray in the town of Poughkeepsie. Ray has a question regarding vaccines, as most people do. Ray, go right ahead.
Can you hear me?
I can hear you. Can you hear me?
Oh, fine. Well, actually, I've had 2 questions. How is the vaccine distributed in the county? Does it come to one place and then distributed to county, pharmacy, hospitals, and other places? Or are these distributions all independent of each other?
That's a great question. They're actually independent, but distributed from the same location. So the federal government distributes an allotment from and to the state. The state then distributes to those locations. So most of the pharmacies, although I know this gets confusing, some actually do get federal distribution, but everyone gets their distribution separate and apart from one another. And for your reference, we generally are advised on Sunday or Monday as to the total allotment coming to the county, and then Monday or Tuesday, Dutchess County government receives its doses. And this last couple of weeks, as I've said, we've received 1,200, although this week we are actually going to receive somewhere in the neighborhood of 3,000 for this week. So a good question. That's how this federal government and state does it. I will say the federal government should be commended for the speed by which they were supportive of getting the vaccines, in essence, developed, right? And committing to purchases and at least getting that up and running. The distribution from the federal to the state government's very limited, and then the state government's distribution, I mean, we can get the doses, but the centralized coordination has been very weak, very chaotic, and very complex.
It sure has.
And sadly so. So that's that. Yeah. Okay. So yeah, go ahead. I'm sorry.
I've been trying to figure out how to get there, but the county gets your distribution on Monday or Tuesday.
That's true, but that really doesn't mean anything for you. If you're signed up on the county's website or you called to get signed up, we alert you when the appointments become available. You don't have to race to find out. You don't have to sit by the computer. You just wait for us to reach out to you, and we'll do that if you're signed up at Dutchess.gov and the vaccine information form. Okay?
Well, I've done that. The problem is I've been trying to check the CVS and other pharmacies and can't seem to figure out when they get theirs.
Again, they're the same boat. So if you go to our website and dial and visit Dutchess.gov and then scroll down, at the very least, those pharmacies will have their links there. So I appreciate that. We're going to jump to a couple more questions. A couple questions regarding. Couple questions about what if you don't have a primary care physician. First, any physician you do see. So if you have, for instance, if you see your OBGYN, you're a woman, and you see your OBGYN, and that's that they certainly can confirm whether or not you have a a comorbidity. If you're seeing a specialist because of a particular ailment or illness, they can certainly sign off. And if you don't have a primary care physician or someone that you can easily access or get to, the form can be completed by a pharmacist as well. So if you're taking medications that might suggest an underlying health condition, again, the pharmacist can sign off on that as well. A lot of questions about why don't any doctors have vaccines yet. New York State, New York State, New York State. Why don't doctors have greater access? Because right now the state of New York is not distributing vaccines to physicians. We agree. What we would have done certainly is started by getting vaccines to the local health departments and area healthcare networks, because of course it's easy. You can get to your physician. There were some legitimate reasons, like storage of the vaccines early on that I know the state wanted to address, but that could have been addressed and just hasn't been as of yet. So if there are other questions, if you're on the call, dial 0. We'll get you in for a question and try to get to as many as you can. If you have a question and you're following us on Facebook, please write it in the comment section below the live stream. Is it necessary to get a vaccine if you've had and recovered from COVID? Dr. Anil Waithian, our Commissioner of Health, an infectious disease doctor. Dr. Waithian, is it necessary to get the vaccine even if you've already had COVID and, in quotes, recovered?
That's an excellent question. Mark, what I would say is individuals who've had a symptomatic bout of COVID probably has protective antibodies. They are not, there's no contraindication to them getting a vaccine. So if they choose to wait 90 days until they get the vaccine, they can. But oftentimes, if there is an opportunity, especially those that just test positive, as opposed to having a symptomatic bout of COVID, if they have the opportunity to get the vaccine, as a physician, I would recommend that they do.
And so, and so we also always get questions, Dr. V. If I've gotten the vaccine, why might I still, have to be considerate, and consider some distancing, wearing a mask, that sort of thing? Why would that be necessary?
Sure. One of the things that people, even if they're vaccinated, the vaccine provokes an immune reaction in our bodies, and our bodies can fight off an infection, meaning we may get the virus in our nose and throat, in those portals of entry, but that virus may not cause disease because we've been vaccinated. But there is a potential, and we're waiting on data to see how protective it is, but there's a potential that if our nose or throat is harboring the virus, we could potentially give it to others. So that is why the current recommendation stands that even if you've been vaccinated with 2 doses, you still have to wear a mask and abide by the mitigation steps that have been circulating.
Thank you. Number of questions regarding the selection for the vaccine. Let's pull up the vaccine form again, just as a reminder. If you fill out our vaccine information form, will get you into our system, right? It's sort of like a wait list. Fill that form out, we'll get you on the wait list. As far as randomizing, again, the IT department simply, this is a spreadsheet, right? This is just a spreadsheet that just randomly pulls out names based on who we have to vaccinate. So, for instance, somebody asked, are they sort of categorized? Well, this week we're focused a lot on those with comorbidities. So, if you have identified comorbidity, it would be in that randomized selection. When it comes to essential workers, this has gotten a little bit confusing. We are required by state order to vaccinate those who are identified as essential workers. That's principally schools, emergency response. There are daycare and some retail positions like grocery stores. We've done outreach to those employers. We simply go to those employers. They tell them we have a number of slots available to them. They select the individual. So if you're a school district employee, for instance, It is likely that your supervisor, if they should have asked who is qualified and who wishes to be vaccinated, that supervisor shares that information with a point of contact in the school district. Generally, it's the superintendent's office. We advise them every week that we may have 5, we may have 15, we may have 20 doses available, and they select individuals from their list. So if you work in a school district, you work for a particular public employer, you should reach out to your supervisor, make sure you're on that list. That's how they select names. And we're very close, in fact, to completing several school districts with vaccines for those who wanted them. And that's, I think, important. Janet had a question. Janet, you're on the phone line. Janet had a question regarding how long does she have to wait, and why don't we take that question? Janet, go right ahead.
Hi, Mark. How are you?
So far, I'm okay.
Okay. Listen, I listened to you last month about putting my name, and I did, over to Millbrook Pharmacy.
Yeah.
And I have not heard a thing if they've even gotten the shots. We keep getting online.
Yeah.
And they're down here in Dover, and we keep seeing where they're filled.
Yeah.
So and I have an autoimmune problem. I have three very bad autoimmune problems. I don't know what the problem is, why I can't get one.
Well, you and 100,000 other people are waiting for 1,000 shots a week. So the challenge is to obviously get to as many as they can. Now, I do want to clarify 2 things. One, if you're signed up with a local pharmacy, you should check that regularly because they are getting doses each week, and their schedule might change at any given moment. So it is important, right? Even if you're signed up with the county, you want to check those pharmacies. Now, as far as
but we have been told from the pharmacy, and I'm sorry to interrupt.
You're allowed.
We're not to call when they get it in. They will call us.
That's true, but if you go to our website, I know it stinks you've got to be online, but if you go to our website from time to time, their pharmacy links, there's a link to the pharmacies on the website. From time to time, they have appointments available. So you should check that. Now, the last thing I'd also say is if you're signed up for our vaccine information form with a comorbidity, yeah, it's going to take some time. I mean, it's random. It could be tomorrow. It could be six weeks from now. So do make sure, though, that you've updated and your information is accurate in our vaccine information form. If you filled that out a month ago, we did ask you to update it again about 2 weeks ago. So please be sure that at Dutchess.gov/VaccineInfoForm, Dutchess.gov/VaccineInfoForm, you've updated your information, and hopefully we can get to you. That's our goal. And the Dover site is only those through random selection, so that's going to be filled based on the appointments we have available.
And that's sad because I'm right here in Dover, so I can't even go to my own area, and it's not even CVS doing it. So yeah. I think this is crazy.
We agree. I'm just trying to make it work within the state structure, and this is the best we've got at the moment. Hopefully, with more doses, you'll be able you'll see it availability. And I do suggest though that you do make sure the information with us is up to date. And we appreciate the question. If there are other questions, dial 0 on your phone. We'll try to get to as many as we can. Let's quickly go through some of the vaccine information. If you're on the call, dial 0, and we'll try to get you. You're on the phone line with County Executive Mark Molinaro. This is our monthly telephone and Facebook Live town hall. We will be back with you next Wednesday. We're going to be on for a little while longer this evening. We're going to be back on next Wednesday, Facebook Live, 3 p.m., and then the next telephone town hall is scheduled for March the 24th. So next Wednesday, 3 p.m. is Facebook Live. March the 24th is our next telephone town hall. Again, if you have a question, write it in the comment section below the live feed on Facebook, or dial 0 on your phone, and we'll get you in for a question. Again, if you're 65 years of age or older, you don't have internet access, you can call to set up on our wait list, 845-486-3555, 845-486-3555. Press 1. When you press 1, you'll get a vaccine update. then press 2. When you press 2, you'll be sent to an Office for the Aging representative who will help input your information into our system. If you know someone who also needs that availability and that help, please share with them that phone number at 845-486-3555. Again, if you go to our website at Dutchess.gov and scroll down the page, you'll see not only the vaccine information sign up, but also there'll be information regarding the state sites. Those state sites may have availability. Further down the page are the links to pharmacies who may have appointments throughout the week. Please visit that as you can, the website. Hospitals, federal qualified healthcare clinics, and doctors' offices. Also want to note, if you are a veteran, you can also try to get a vaccine that's a walk-in clinic at the VA. And the VA Hudson Valley is the Castle Point campus. That's on Thursdays, Fridays, and Saturdays at Castle Point. Thursday, Friday, and Saturday from 8:30 a.m. until 3:30 p.m. Those are walk-in clinics for veterans who are 65 years of age and older or have a high-risk medical condition or are frontline essential workers. If you would like, Thursdays and Fridays, they are available also at the Montrose campus. The phone number for the VA is 845-838-7668, 845-838-7668. We are making progress. There are some updates this week. Since last week, the state of New York has advised that beginning March 5th, movie theaters in New York City can open at 25% capacity. All pool halls outside of New York City can open at 50% capacity. That was a question that's come up a few times. Pool halls can open at 50% capacity. Movie theaters can stay open 25% capacity. I do want to mention that Major League Baseball has announced a baseball schedule. We are expecting the very first home game of the Hudson Valley Renegades, a New York Yankees affiliate, to be May 11th. And while there will be some limited capacity, we expect that we will have fans in the stands on May the 11th for our very first home game at Dutchess Stadium, or very first as a Yankees affiliate. And we're grateful to the legislature for providing support to make an investment at Dutchess Stadium. But we expect May 11th we'll be welcoming the boys of summer back to Dutchess Stadium, this time as a New York Yankees affiliate, our Hudson Valley Renegades, May the 1st. We're getting a lot of questions, both online. Getting questions online about filling out. I've submitted the form, or vaccine information form, 3 times and still no call. There is absolutely no need to fill out that form several times. In fact, just once is all you need to do. Just fill it out once. It's random. There are 100,000 people in Dutchess County who qualify under the state regulation to access a vaccine. We receive 1,200 a week. So just if you're on this form, it is going to take time to randomly get to 100,000 people. Now, it'll pick up as people have other opportunities, but that is currently the system that the state of New York has left us with, and so that's, I think, important to know. Let's go to Gail. Gail in the town of Poughkeepsie had a question regarding comorbidities. Gail, go right ahead with your question.
Thank you for taking my call. Can you hear me?
Yes, I can. Can you hear me?
Okay. Yes. How does the process work once you sign up and you get on this website and do the sign up? Now, do you get an email, a phone call? Do you get something to show that you can go to the vaccination site?
Yes.
Besides what I need to take from my doctor?
Good.
So how does that work?
So first, you said it. So I do want to remind you, if you have a comorbidity, you do need some letter from your physician. You know that. So when you're selected, for the appointment, if you left us an email, you'll get an email. If you left us a cell phone, you'll get a text message. But you'll be advised that there's an appointment available depending on what information you gave us: email, phone number, etc. Generally speaking, you will get an email. And with that email, we will ask you to confirm that you're available for the appointment. We fill that out with you, or we give you the link to fill it out, and then you're given a ticket. So one or the other will happen. You'll either be notified, and we'll walk you through filling out the and picking the appointment date, because we are doing some by phone, or you're going to fill it out yourself. and then you're going to get a ticket that gets sent. It's actually emailed to you from the state of New York that says, this is the location, this is your appointment time, and I think it actually may even have a QR code or something on it that confirms you are the person that you say you are. This is the information you need. You go right to the appointment. So you're going to get an email, a text message, or a phone call, any one of them, depending on what you gave us, and then we'll get you filled up for the specific time that you would get for your appointment, and you get an actual ticket to get to that location, and that'll confirm that you have the appointment to be there. If you're on the phone line and you're joining us this evening, this is County Executive Mark Molinaro. You are joined as well by Dr. Anil Wythian. Dr. Wythian is the Commissioner of Health here in Dutchess County. We are taking questions both on the phone. If you're on the phone and have a question, dial 0. You'll be asked to record that question and then be brought live to ask that question. If you're on Facebook with us this evening, simply write your question in the comment section. We're not going to get on Facebook tonight. We won't get to every question, trying to get the sense of questions. So somebody says to me there's multiple questions about vaccines, etc. We'll try to get you those answers. I do want to note that the county's Independent Reapportionment Committee was selected. This is the first ever. We have established this reform. This is an independent body that will draw the lines for the county legislative districts. Their first virtual meeting is tomorrow at 3 p.m. They have very limited work to do tomorrow. They'll be selecting a chairperson. And if you scroll down here on Monday's post on Facebook, you'll be able to see the Zoom link. But if you'd like to monitor and watch this meeting, here it is, Dutchess.gov/IRC. I assume they can get that information to participate in the meeting there, and the webpage is live for you as well. On March the 9th, the Department of Behavioral and Community Health will hold a virtual public hearing on all issues related to those with intellectual and developmental disabilities. These are services offered in the county. This is our town hall meeting on that topic, very important to so many. March the 9th, 5:30 to 7:30 p.m. What is the process for booking your second dose? How do you guarantee supply for the shot? Great question. We had a question regarding second doses. So, if you received your dose in Dutchess County's health department, went to one of our pods, before you leave, you will be scheduled for your second dose. Correct, Dr. Wythian? When you leave your first dose, we schedule you for your second dose.
That is correct, Mark.
And what guarantee is there that we will have a shot for you on your second dose? Do you know that answer? I do, but I'll let you answer it if you want to.
So once a dose is given and the numbers are shared with the state, a second dose is already allocated for that individual. And so the only question is scheduling that appointment, and we built that into our pod planning.
So to confirm, you get your first dose at a Dutchess County Health Department site. We schedule you for your second before you leave. And the state of New York, upon being alerted that you received your first dose, reserves a second dose. Now, I will say this because some people have done this. If you're scheduled for your second dose and you need to cancel that second dose, it is not easy and instant to get your second dose scheduled. So, to the extent possible, please keep your second dose appointment. If you have to cancel that second appointment, you can't be there for some reason, every effort will be made to try to get you to a location, but it may not be where you got your first dose. It may have to be some other location, and there is always the chance that that dose is not going to be available, so please, to the extent you can, keep your appointment for that second dose. Does that sound right, Dr. V?
Absolutely, Mark. And we are encouraging all people to stay on schedule and get their second doses as scheduled.
And let me say, I've been to many of the to our pods, our clinics that we host. I do know, and Dr. V laughed at me when I said this. I said, as I was leaving Dover, I said, there seems to be so many people here. He said, well, not everybody comes at their appointed time. And I looked at him sheepishly and said, you mean people come here early? And you laughed at me, Anil. It is not necessary for you to get ahead of your appointment. In fact, it does create a little bit of a delay. So we're just asking folks to try to stick to your appointment. We understand if that's not possible. But, you know, we do notice on any given day that people kind of flood in early in the hopes they can get through earlier. That is entirely possible, but you could also be in a position where you're slowing things down. Does that sound about right, Dr. Wythian?
That is correct. What we try to do is have a very controlled environment and not overload or, all the measures in terms of social distancing and throughput. If people adhere to their appointed time, things go much smoother.
Yeah, exactly. And so I understand the desire to get in and get out, to get off to your kids' practice or back to work. But do try to stick to that schedule. It just makes the process easier. And actually, our clinics have been seamless. I mean, I know that we always can point to areas for improvement, but generally speaking, they have just been seamless. And Dr. V, that's a credit to you, to Kathy Tetmeyer, Joe Ryan, Jim Soto, the Medical Reserve Corps, and all those who have been working and volunteering there. This is going to be a busy week this week. Anil, going to be a busy week this week?
Absolutely.
We're actually administering the most we've had. This is about 3,000 doses in Dutchess County's health department administered really within a 10-day window. So we have clinics really through next Wednesday, and we're staying busy, partnering with a number of others as well. Good for that to happen. Hospitals this week do have some doses, or federal health clinics have about 1,000 doses. There's probably 5,000 to 6,000 doses being administered countywide among the different entities. That's the most we've had ever, and that so far, and that's a very good and promising thing. The federal government did provide a noticeable bump in allotment, and that meant federal health clinics within the county. Some new pharmacies received doses, and that's all very, very positive. We're going to go to Diane. Diane had a question regarding her attestation form, which is just a word I like to say. Diane, in just 1 second, why don't you go ahead, Diane? Do we have Diane?
Hello?
Hello, Diane. How are you?
Hi, good. Yes, I just have a quick question. If you fill out that form and you go outside of Dutchess County to get your shots, like one of the state sites, do you need to fill out a different form, or is that one sufficient?
We believe the one we have is sufficient. Now, it is definitely sufficient in the Mid-Hudson region, meaning that all of the providers in the region were given an opportunity to kind of, if they wanted to create something, they could. This should be sufficient. If it's signed by a pharmacy or a physician, it is acceptable at any one of the locations that the state offers and provides, and that's why our form is somewhat generic looking, but does give you the ability, obviously, to have the physician's license number, so there's some authenticity about it. So it would definitely work for you wherever you go. Okay, thanks.
Okay, thank you.
Great question. We appreciate that. If you have a question, dial 0 on the phone. We'll try to get to you. If you have a question on Facebook, simply write your question in the live in the comment section below the live feed. I was told that I should acknowledge that I keep my phone here because sometimes we do get messages, and every so often I check my watch, and it is an iPhone. It's an iWatch, and so an Apple Watch. So every so often I get a message, and I don't want people to think I'm not paying attention to them. I'm getting a question. I only know that because my cousin, my favorite cousin, Dana, who likes what I say, she's my favorite cousin, has been watching and wanted me to be sure to tell people I'm not being rude, and I'm not going to fill out her form. She's young enough and capable of doing it herself. So there you go. This is what we do now. I get random messages. Great visitation. Nursing home visitation. I don't have the guidance here, but basically the rules are opening up. Dr. V, I don't want to put you on the spot. Do you know offhand the basics on nursing home visitation? We'll add it to our website and get it updated on Facebook. But Anil, are you familiar with? I know that their changes are now available, and basically it's a much more open environment. Do you recall some of the specifics?
I have not read them through, but they did distribute that early, late in the afternoon. But I will tell you that, again, it loosens things, as you mentioned, but it gives a lot of latitude to the individual facilities.
Okay, and so why don't we do this? If you're asking about the nursing home visitation, and I think because we didn't see the final guidance, we weren't prepared with a slide tonight, but we'll make sure to post that on the county's Facebook page so it's updated, and it will also include it, I suppose, on the county's website, the vaccine information, the COVID update, and so you'll have it there as well. A couple questions regarding the clinics vaccinating. Somebody said they thought healthcare workers were all done. First, the healthcare workers that have agreed to be vaccinated, most of which in hospital settings have been, but there are plenty that are not in hospital settings that still have to be vaccinated. Now, the Dutchess County clinics, so the ones that our local health department are responsible for, this is at the JCPenney's location and the Dover site at the former CVS on 22 in Dover. We are responsible for 1B essential workers. So that could be some healthcare workers, that's 1A, but 1B is fire, rescue, emergency response, courts, law enforcement, transit workers. It goes on and on with a fairly extensive list. We are also at our clinics responsible by order of the governor to focus on residents and staff with developmental disabilities. And also individuals with comorbidities, underlying health conditions, and we've identified what those are on the county's website, and the updated information is available to you. Why don't we go to Ricardo? Ricardo had a question about pools opening in the summer. Ricardo, if you're there, we're going to go right to you in 1 second. We lost him. We lost Ricardo. Ricardo, pools can open this summer. The state has issued guidance. Summer camps, summer activities can open. There'll be some capacity restrictions, but yes, Splashdown can open effective April. Outdoor recreation facilities like that can open as well. So that's important to know. Do we want to go to Sandra? Sandra had a question. Sandra is from Stanfordville regarding vaccines. Sandra, go right ahead.
Thank you for answering my call. I had a question about the nursing home visitation. But my question was, the possibility was that you would have to have a COVID test 7 days prior to your visit, within the 7 days. So I was checking with a local pharmacy and to see if where we would go to get the test, if that had been discussed or not. And I also asked about the price of the test, and he said it would be $90. And I asked if the insurance companies would be considered partial payment, and he said no, there wasn't any insurance coverage for that. And that's not what I've heard in the past from other people, so I wondered if you had any clarification on that.
That's a good question. So for required testing, like if you happen to believe that you've contracted the virus, the insurance companies are covering that. You may have to still pay a copay, but insurance companies do cover that. Anil, when it comes to sort of this selective testing, they're correct, right? The insurance company doesn't have to cover that particular test, but there are alternative locations that might be more affordable. Anil, do you want to take a stab at that one before I do?
Sure. This issue has not been resolved, and it continues to sort of vex people. The fact of the matter is, individuals who are symptomatic, the vast majority of insurance companies will cover that. But again, individuals who travel, who have other reasons because they're just curious or have other requirements, even job-related requirements, I've been notified that they have refused. And so some of the possibilities include, fully qualified health centers that might have a sliding scale, include stand-up state sites. But I do realize that this is still a significant issue.
Fair enough. And so some of the details, beginning the 26th of February, visitors, so Sandra's correct, visitors must present a negative test within the past 72 hours. And the nursing home may also administer rapid testing. So do they have to have a negative and the rapid testing? It's possible at the door, or they could get a rapid testing negative and that would suffice. So it's possible the nursing home itself may have access to rapid testing. There are other locations, Sandra, that I believe her name was Sandra, I apologize, that may have some availability as far as testing. So do visit our website. There may be opportunities that there's more affordable options, but it is definitely an issue that we recognize could be very costly. But again, the nursing home itself may have access to rapid testing, and that may be an option that you should consider and ask if you are visiting a loved one there as well. I want to remind you that you can find that testing information at Dutchess.gov/coronavirus testing. Or again, you can always contact us at 845-486-3555. That is the COVID hotline. Try to get you some additional information. We want to go to another question. Kathy in Northeast has a question regarding a caregiver. Kathy?
Hi, how are you?
I'm great. How are you?
I'm hanging in there, thank you.
Yeah, good.
Okay. I myself am 67. My husband is 73, and now he has a broken hip. And I have my mother, who is 101, going on 102.
Wow, congrats. God bless her.
She'll be that on March 7th. Anyway, my son is 46, and he does so much for us. Pretty much everything. He is our health care provider here. And we were wondering, or he was mainly wondering, he wears a mask even coming into our home. But how can he get a shot? Or can he get one? Or whatever.
Currently, sadly, simply being a caregiver is not listed on the state for these categories. So right now, the 1A, 1B may not qualify him to access a vaccine. What I would offer to you is first, I'd be certain that he doesn't have one of the underlying vulnerabilities. There are a lot of health conditions that do qualify an individual now to qualify for a vaccine, and he should check that. But currently, the state of New York doesn't list him as an individual who would qualify for a vaccine. And I'm sorry for that, because we agree, in particular, caring for someone who does pose a higher risk. That would be obviously logical, but the state of New York hasn't included those individuals as of yet. And so we'll keep you posted. He should fill out the form anyway. I'd get on the vaccine information form as it is, and as that becomes available, we would be able to get to him quicker. So do get on the list. We are getting questions for who and what groups the county is responsible for vaccinating. So let's go to that for a second. Dutchess County government, our local health department, again, responsible for certain categories of people. Phase 1B essential workers, we'll tell you who they are in a moment. Phase 1B essential workers, residents and staff with developmental disabilities, in particular those at OPWDD facilities, and all individuals with comorbidities. Let's jump to 1B. 1B is anyone over 65 years of age. Is that correct? But that's not essential workers. So 1B essential workers are first responders, fire, police, National Guard, support staff, public safety communication workers, civil, sworn and civil personnel, corrections officers, in-person college instructors, pre-K to 12 school teachers and staff, child care providers, grocery store workers, public transit workers, homeless shelter residents, and staff. Those are the 1B that we are responsible for. We are also, as I said, responsible for those with comorbidities. We have a comorbidity slide. The comorbidities are here. Cancer, heart, lung, kidney, liver, and/or brain diseases. Anyone with a developmental disability, intellectual or developmental disability, any heart condition, any immunocompromised condition. And by the way, immunocompromised could be that you're on medication that compromises your immunity. So that's something to be aware of. Obesity. And again, based on my knowledge of body mass, obesity is a sliding scale. So make sure that you might not necessarily think you are, but maybe the physician says you are, and that's something to be aware of. Pregnancy, sickle cell disease, type 1 or type 2 diabetes, neurological conditions like Alzheimer's or dementia. Did I asthma and that sort of thing not listed? I thought they were. Dr. V, asthma?
I don't believe asthma per se, but pulmonary disease, COPD, is included.
Okay, fair enough. We did get a few questions regarding that, so at least you know. If you have other questions and you're watching us on Facebook, please write it in the section below the live stream. We also have a couple of questions online. If you have a question, dial 0, and we'll get you in to record that question and get you in. So I apologize. Dial 0 to ask a question if you're on the phone. Why don't we go to Diane? Diane is in Unionvale. Diane had a question regarding our request for a mass vaccine site. Diane? Diane is not there yet. Did we lose Diane? Diane has gone missing on this. Okay. Diane's question, though, was specific to our request for a mass vaccine site. And we have not yet received a response from the governor's office, but I can tell you again, we did receive that additional allotment of doses this week, which really will expand our capacity. We'll be busy these next several days. I think we have a question from Gail. Is it Gail in East Fishkill? Go ahead, Gail.
Hi, I have two questions,
Oh.
and I hope you answer.
Okay, you bet.
The first one is that if you have registered by telephone and not by internet, and they call to say that you have a scheduled appointment at a certain place, what if you're not home to receive that call, and how long do you have to call them back, or are you just skipped and put to the bottom of the list?
Why don't you ask your second question, and I'll get both of them at the same time as I look over to my friends to remember what the answer to the first question is.
The other question is that if you're assigned a place to get your vaccine, your dose, and it's out of your general area, and it's far for you to travel, can you request a place closer to your home? Where I'm 81 years old and my husband is 80 years old.
Well, so the answer to your second question is sadly no. We only have 2 locations that the health department provides vaccines, although if you're living in East Fishkill, at this point, the only 2 locations that we have, one is in Dover on Route 22, that's probably about 25 minutes from your house, or the other is at the J.C. Penney's facility, building at the Poughkeepsie Galleria, and that's probably about the same distance, 25 or 30 minutes for you there. Those are the only 2 locations the county has currently for vaccines. As we get more vaccines, we may end up having one at the senior center in East Fishkill or that sort of thing where we'd be able to bring vaccines closer to you. But no, sadly, once we have those appointments available, then you really would have to go to the location identified. And so we do leave a message. We do ask you to call back. We just can't hold spots very long. So understand, if you get that, so if you're not able to answer the phone, and you get that message, you should simply call back. It's not held for you indefinitely, but because there's so many that have to be scheduled, there is always the possibility that you're calling back and we can just get you in. So what we tell people is this: please if you have a cell phone and you carry that cell phone with you, give us that number, because that number is the one you're likely to answer if you're out and about. If you're home and you miss the call, you're taking care of your loved one, you can call us back. We just can't guarantee that slot stays open, very, very long. But there's always the chance that when you call back in short order, that appointment will still be available to you. So I appreciate both of those questions. As we get more doses, this will be easier. But for now, the state's made it overly complicated and very frustrating. We're going to go to Donna in Hopewell. Donna has a question regarding symptoms, masks, etc.
Yes, my question is, I heard Dr. Fauci say that even though you get the vaccine, sometimes, you're not going to get the symptoms, but you still be checking positive. And anybody around you could get it from you, and you wouldn't even know you had it. So you should wear a mask even after the vaccine. Is that true?
Dr. Wythian's on the call. The short answer is almost yes, but Dr. Wythian, we've talked about this a couple times. If you've gotten the vaccine you still can carry the virus with you. Do you want to talk about that a little bit?
Sure. Before I do that, I just wanted to make a quick correction. Severe to moderate asthma is an accepted comorbidity for that list. With regard to your question on masks, the important thing to realize is the vaccine, whether it's the Pfizer or the Moderna, is extremely effective in preventing disease, and especially severe disease. But we don't have enough data yet to say that it reduces transmission to a significant degree. We believe it to be the case, but it also stands to reason that individuals may be colonized or may harbor the virus even after vaccination, and this is why the recommendation still holds that they follow the mitigation steps and wear a mask.
So
Okay.
yeah. So you did the vaccine itself, though, Dr. V. Why don't we talk a little bit about the effectiveness? We know a lot about the. Certainly, we've talked a lot about the Moderna and Pfizer shots. Those are estimated at what level of effectiveness, and then we expect some word from the FDA on the Johnson & Johnson single shot, and then there are questions about the effectiveness of that. Do you want to answer those?
Sure. Very quickly, what I'd like to impress upon people is that when you have vaccines that are, say, 60, 70% effective, we call that an incredibly effective vaccine. Both the Pfizer and the Moderna platforms are 90 to 95% effective, especially in preventing hospitalizations and severe disease. And so they're incredibly effective. With regard to the Johnson & Johnson platform or vaccine, it's a different technology, but it's still very highly effective. The overall combined effectiveness varies depending on the population and the severity of the illness we're taking into account, and also the strain that we're taking into account, but it ranges to about 70% effectiveness.
Thank you for that, and so we do expect that the FDA, I guess yesterday, felt that the Johnson & Johnson shot was, I'll use my words, safe and effective, but they have not yet signed off on its use. Is that a fair description?
That is correct. All the information point to the fact that it's effective and safe, but we're still waiting for that authorization to go ahead and distribute and use the vaccine.
Great. We have a question from Mary in LaGrange about the UK variant. Mary, why don't you go ahead?
Hi, Mark. Thank you for answering my call.
You're welcome.
So I wanted to know what the county is doing to respond to the UK variant recently identified in Dutchess. It's a more contagious strain. And, I've been monitoring the dashboard, and I've noted an uptick in cases. I don't know if that's a correlation or not, but it certainly makes me very concerned that it may be, and if that is the case, that Dutchess could become overwhelmed, especially with the vaccine, the difficulty getting the vaccine. I feel like we're kind of sitting ducks.
Well, it's a good analogy. Although I think I'll have Dr. V talk a little bit about the UK variant. I do want to say this though. Just keep in mind that even based on the numbers, right? Dutchess County is still accessing about the same percentage of vaccines as any other county in the state. So we're not uniquely different than anyone else. In fact, only in the region does Westchester County, I think, have a significantly larger portion of doses than they are population. And if you look at the percentages of population, we hover between 10 and 14%. With Orange and Sullivan at the lowest end, Dutchess in the middle, and we're going to pick that up this week. Just 700 additional doses will likely get us to 11.5% of our population with first doses. So just keep in mind that from a vaccine distribution point, I know it seems like it's so complicated because it is, but it's not any less complicated anywhere else. So we're all sort of in that boat. As it relates to positive cases, always monitor the positivity rate, because on any given day we could get 50, 60 cases in. That doesn't mean they're all from the same time, right? So you go in, you get your test. The test results could be a day, it could be a week, and they come to us at a moment in time. So that positivity rate is that number that's important to monitor, because that's basically the number of positive people versus the number of tests. And that gives us this indication of where we are. And we are still trending, Dutchess County. We're at 3.8% is our current positivity rate. When you match that against other counties, the 7-day rolling average for us is 3.8. Orange is 6%. Putnam's at 3%, Rockland's at 5.4%, Sullivan 5.2%, Ulster's at 2.2%, and Westchester's at 4.1%. So we've hovered in this, I'll say, between 2.5% and 6% in the Mid-Hudson region, really all along. So we're not seeing a trend, but you are right to be concerned about new cases. Dr. V, do you want to talk a little bit about the UK variant? Mary's correct. It's more transmissible, but not necessarily more severe.
Sure. That's a very good question. What I will say is that when you have any pathogen, and in this case, a respiratory pathogen that affects a great percentage of the population. What you're going to see with each cycle or transmission cycle or generation, you're going to see variation in its genetics. So there's mutations constantly. And so one of the mutations that have been identified is the UK strain. There are other strains. There's a California strain. There is a South African strain. What the mutations do, it could make it more effective at dividing. It could make it less effective than dividing, or more pathogenic or less pathogenic. For the UK strain, what we do know that is it's much more easily transmissible, but not necessarily causing greater morbidity or mortality, meaning more people end up in the hospital or more people who succumb to the illness and die. With regard to the message that we send people and how we prepare is the same mitigation steps that has served us all along during this pandemic is extremely important that we adhere to it and are diligent and stick to it, because again, that is what's going to protect us as more and more people get vaccinated and we get closer and closer to herd immunity. So we double down on those mitigation steps that we have been abiding with and has assisted our county thus far.
And that really, if you're asking us what are we doing to combat it, we're just reminding people to remain vigilant in that regard. Continue to wear masks, continue to keep that physical distancing, wash your hands, but also monitor your own health. I know it's easy after a while to kind of ignore symptoms here and there, but if you're not feeling well, you want obviously to contain that and protect your own health and the health of others. So if you're not feeling well, you're not going off to school. You're certainly not going off to work if you can get away with it. And again, taking those mitigation steps slow the transmission of any like virus. But in this case, that's how we will weather this particular storm. And as more people get vaccinated, we're going to get closer and closer to that concept of herd immunity. Dr. V, we get questions often about, what happened to the flu this year, and why don't we see so many cases? If we didn't have COVID, but we told everybody to wash their hands, keep socially distanced, and wear a mask, what would happen to the flu transmission? Anil? Uh-oh.
Sorry, Mark, I was on mute.
So you heard my question. If we didn't have COVID at all, and we told everyone, wash your hands, monitor your health, keep physically distanced, wear a mask, what would happen with the flu, do you think?
So one of the things that could happen is it's hard to predict how a typical flu season will evolve, when it will peak, how much it will affect the population. But, we know that the mitigation steps and the steps that we're taking for COVID are the protective things to prevent getting the flu and transmitting the flu. So I would expect that the season would be blunted and muted like we're seeing now.
And we did, right? We did see a decline in flu transmission. It's not that we didn't have the flu. It's that people were obviously containing it a lot more than they would have otherwise. And that's because the mitigation steps that we've asked people to take are effective for slowing the transmission of COVID, but also slowing the transmission of the traditional flu. We do have a question from Greg in Poquag regarding college students, and it's always a good question as students are coming back into town. Greg, go right ahead.
Thank you, Mark. I just had a question about when there's more widespread availability. We have a lot of colleges in Dutchess County, and we, I think, know that those 20-ish-year-olds are main spreaders of the virus. Has there been any consideration or work with the colleges to secure eventually some vaccine for those college students and having mass vaccination campaigns within those colleges to reduce the spread in those college towns? Thank you.
You're very welcome. So currently the state does not have access to enough vaccines to make that sort of readily available, although I will say the colleges in certainly, I mean, this isn't entirely unique to Dutchess, but the colleges in Dutchess County have been very vigilant in containing their campus activity. And so, and by the way, they do have individuals on campus who can either administer vaccines or can be trained to administer vaccines, and we have worked with them to prepare for the eventuality that there'd be easier access to vaccines and thus the ability to vaccinate. But we just don't have doses, and the state isn't making those doses available. But I do want to address one thing, Dr. V. We've lived 12 months through this virus. The cases that we saw associated with colleges in Dutchess County. Is it fair to say, and again, my memory could be entirely off, is it fair to say that they were principally contained within the colleges, that we didn't see a lot of college to community transmission because the colleges themselves, and we did have college students for periods of time these last 12 months, because the colleges themselves really worked hard to contain, but when we did have cases, they were generally among college residents or population. Is my recollection correct?
That is a reasonable assessment. We did have a couple of clusters with regard to off-campus housing, and even in those situations, once it was discovered, it was contained fairly quickly.
And so we continue to work with the colleges regularly, yes, when there's access to vaccines, we are prepared for that to happen among college communities, but the state just, and this is not the state's fault. The state of New York, like every state, just isn't getting enough from the federal government to sort of target all of those populations. But we monitor that, and we are working with the colleges for what hopefully would be that opportunity. If you have any last questions on Facebook, simply write them in the comment section below, or if we have any left on the phone line. We're getting close to the end of our town hall. This is County Executive Mark Molinaro. We appreciate you joining us this evening. On the line with me tonight, as he has been many, many times, Dr. Neil Wythian. Dr. Wythian is our Commissioner of Health, an infectious disease doctor. And we are scheduled to be back again next week. Our Facebook town hall will be at 3 p.m. And then again on Wednesday, March the 24th, we'll have our telephone town hall and Facebook Live event at 5:30 p.m. We try to mix them up. Daytime, some afternoons, and evenings. Let's go to Carrie. Carrie had a question regarding percentage of vaccines. Go ahead, Carrie.
Hi, thank you for taking my call.
You're welcome.
I actually, I did see the chart today for New York State, and they did have the county as the lowest to all of the counties in New York State as being the lowest, and we were at 83 and 80%. But my other question was more so the fact that most of everybody I know who got the vaccine actually has left the county in order to get the vaccine and have been very successful, whether they've gone to Manhattan or into other counties, and also people who went to Connecticut before Connecticut had closed off. And lastly, I understand that there are politicians, and I know somebody who benefited from this, who are being allotted 1,000 vaccines a week for them to disperse on their own accord. And I was just curious if you can answer that question for me. And I do know this to be fact, and I know somebody who benefited from it. So I was just wondering, is it going to politicians, these vaccines?
No. I mean, certainly not in this county. I don't know of a single person in Dutchess County who has gotten access to doses that isn't those organizations we've identified. So we each week get told.
Right.
And so what I do, so let's back up. Really good questions, because there's a lot of reasons to think a lot of things, and that's certainly fine. I don't know the 80% reference that you're speaking to. Dutchess is not the lowest in the state as it relates to vaccine distribution, vaccine receipts, or those vaccinated. In fact, we're right in the middle. In fact, as I said, by the end of this week, we'll be at the state average. Right now in the region, the percentage of individuals who have received their first dose, Orange happens to be the lowest among us, followed then by Sullivan, and then it's Dutchess and Ulster, sort of neck and neck, and then percentage is a little bit higher. You are correct. A lot of people have to leave the county to get vaccinated, and a lot are, the state regional sites, or some did go to Connecticut. But we, in this county, are administering about 3,000 doses a week among different different populations. So it's the health department, pharmacies, others are doing about 3,000 a week, which is really the number in the region because we see it. Every week we get a readout of the vaccine distribution in the Mid-Hudson region. Dutchess is no lower in the numbers we receive than any other county. And based on the percentages of those who have been vaccinated, we certainly are the lowest in New York. So I don't know that reference, but I will say I don't know the politician you're referring to. It sure the heck isn't me. We get approximately, as I said, 1,200 doses a week. That goes to the local health department. Neither Dr. Wythe nor I select who the people are that get vaccinated. That is through this process of signing up. So if somebody's allotting them, then that's just not right or legal. I will tell you that I personally will get the vaccine. I have not yet gotten the vaccine because other than being county executive, which qualifies me as an essential worker, I'm a 45-year-old healthy person, and I have no desire in taking the shot that somebody who has a vulnerability or maybe a senior may want it. And so I'm gonna access it through the same system when healthy 45 or reasonably healthy 45-year-olds have the right to do it. So I'm not aware of that happening certainly not in Dutchess.
It definitely wasn't in Dutchess. It was in another. It was in another county, just so that you know.
Okay.
But it was somebody who did need the vaccine. But it was absolutely fact, and it was disheartening to hear.
Yeah, that is. It is. And so, I mean, I can tell you that that's not legal. So if it's an individual that if somebody wants to report that to the state, they can certainly do that through the New York State Department of Health. But I promise you that that's not how we do it. Now, I will say we do keep an essential worker wait list. So if we have people cancel out during the day, right? They skip their appointment, or we have extra doses, we might go to an essential worker list. But that's generally police officers and corrections officers and so on. So thank you for that call and that question.
Yes, thank you.
It is 7 o'clock. We have hit our limit. I want to thank you all for joining us. This is County Executive Mark Molinaro. You were joined tonight by Dr. Neil Wythe, and I want to thank our American Sign Language interpreters as always. I know that I've said this many, many times, but I talk fast and a lot, and that means that they have to keep up. They say I talk fast and a lot. So we are joined. We're again next. So we thank you both. We're back live with you at 3 p.m. Next Wednesday and at 5:30 p.m. on the 24th of March, Wednesday night. Thank you all for joining us this evening. Please stay healthy. Please stay strong, and be kind to each other.